And in your experience, what types of programs or support do you find public health students value the most?
Yeah, I think any type of networking opportunity is hugely beneficial. Um, for the last, since I've been here, I would say that a big piece of what I find to be super helpful for public health professionals is providing funding to attend conferences and making opportunities for or allowing opportunities for students to go to these professional development um, conferences because you learn so much and the networking opportunities are amazing. And then getting involved in whatever it may be. Our students get a free membership to the Colorado Public Health Association. So I really try to help connect that group with our students. And then I offer 2 webinars a month on different career related topics. And I would say though, my 2 most popular things that I do, well, 3. One is headshots, free headshots, because everyone needs a good headshot and it's hard to get. 2 would be our career practicum fair. We have that once a year at the end of February. And then 3rd would be my job search group. So I am actually currently running, this week starts my May job search group, and I had over 60 people register. So I ended up offering 2 time slots, and that's a group that we meet once a week for 4 weeks, and I help people develop a job search strategy that works for them. But I think what is great about that group is it gives people a space to connect with one another, and you don't feel so alone in the job search process. So I would say those are my most popular. And then one-on-one meetings, a lot of resume and interview preparation and connecting people. I think connecting people to alumni, because I have built so many relationships along the years, I'm always happy to connect our students with alumni. And I think that's also a really good benefit and service that, a lot of our students take advantage of and should. Like I was sending email introductions this morning.
Love it. Love it.
Yeah.
What's the biggest mistake you see on resumes typically?
Ooh, I like this one. Typically, oh gosh, I see a lot of mistakes. Sorry, everyone. I'm always like, please don't hate me, but we got to redo this. Number one's formatting. So a lot of people think if it looks pretty, then it must work, and that's not true. It needs to be able to scan, and I care more about the content. So yeah, if you have some type of like funky formatting or like boxes, I don't know. Sometimes I see these weird, like, I'm like, whoa, I'm having a hard time figuring out where to read. Please don't do that for public health. Just standard resume format, a Word document. I prefer not using any type of format and just creating a Word document. And the content. So I would say content is huge for me, and huge thing I see people not really identifying their achievements. So I see a lot of skills, right? Like program planning and evaluation or data analysis, or just very skill based, but you're not telling us on the document how you used that skill and what was the impact or what was the purpose. So I would say it's a lot of content, a lot of tailoring, a lot of formatting.
Yeah, absolutely. Well, thank you for that.
Yeah.
And we
Yeah.
will take those notes and work on your resumes a little bit better.
Yeah. Exactly.
What do you enjoy most about your work and what do you find most challenging?
I love that I get to meet new people, because that is exactly why I got into this. I love that I can build relationships with people. I love celebrating the wins. Um, And I won't give up until you get a job. Like I am looking for public health jobs constantly. I really, really, really feel passionate about the public health workforce, and making sure that the folks that want to get into it and love it. And I love when I am working with someone and at the end of our session, they're like, I feel so much better, or I have this new confidence or this new energy around this. So, yeah, it's amazing. I tell everyone that I have the best job ever. I'm like, not to brag, but I do have the best job ever. And yeah, it was funny because recently I was meeting with an alum and I was like, you know what, you would be a really great career advisor. And I was telling her why, like what I saw in her. And that day she ended up applying for a career counseling job and got it. And I didn't even know. And she emailed me, a few weeks later. She's like, I would have never have applied for that job if you didn't bring that up. And I was like, oh my gosh, like that's crazy. So yeah, I don't know, making those connections, and if I see something in someone, I say it like, oh, you know what, you would love consulting, or you would love, whatever. I just say it and hope that it helps them. Ultimately, I love that I get to help public health professionals and build the public health workforce. Challenging is not everyone sees the value in career services in terms of, oh yeah, I have a resume, and I'm like, but it's a lot more than that. So I think what's challenging is just being able to make sure that everyone knows that this is a resource they have and can utilize it the way they want in their professional development. Because I feel so awful when I get someone that's like, I didn't even know you existed, or I wish I would have met with you a lot earlier, So I think what's challenging, and I think it's always going to be kind of a higher education challenge, is getting the word out there and getting people to utilize this service. We used to joke in higher ed, like, oh, if you provide pizza, they'll come. But that doesn't really work anymore.
That definitely was a motto during my time.
Yeah, exactly.
Awesome. Well, I appreciate you sharing that.
Yeah.